So first question. Yes, a 4-month-old infant. You can tell me if any other modification. Please do comment. Hypotonia. Patient presented with hypotonia, hypertrophic cardiomyopathy, acid maltase deficiency. What is the, thank you, dear. What's the diagnosis? Yes, we have discussed Pompe's disease previously. This is frequently asked question, recently asked question. Yes, pump, hypertrophic cardiomyopathy, and death usually occur due to heart failure. We all know. Yes. Thank you, dear. So, Pompe's disease, floppy infant, hypotonia, cardiac failure, hypertrophic cardiomyopathy, enzyme deficient, acid maltase. It is both glycogen storage disease and lysosomal storage disease. So mnemonic of two types. Type 2, yes, it is both lysosomal and glycogen storage disease. And in this, we pump with two hands. So you will remember hypertrophic cardiomyopathy and cardiac failure. So simple question, simple answer, repeat PYQ. Second question, a child present with self-mutilation, repeatedly bite fingers, yes, hyperuricemia, behavior issues, which of the following enzyme deficiency may be? So we have already discussed that HGPRT, Lesch-Nyhan syndrome, X-linked recessive eyelashes, yes, नयन X-linked होते हैं, so X-linked self-mutilation gout. Simple question, simple answer, repeat question. Hypoxanthine guanine phosphoribosyl transferase. Next question. Long limbs, arachnodactyly, lens dislocation. This is Marfan syndrome. So they have given diagnosis Marfan syndrome and again repeat question fibrillin 1. Yes, fibrillin 1 mutation. Steroid hormone receptor bind to specific site of DNA by this question we have discussed. If you remember in DNA footprinting, I discussed that steroid hormone receptor just like a duck and he's having finger-like projection, yes, footprinting, and these are zinc finger motif. So these are steroid hormone receptors bind to specific site of DNA by zinc finger. Yes, motif. Yes. So, zinc finger motif. This is taken from Harper steroid receptor family. Do have zinc finger motif. Other option helix turn helix motif. Helix turn helix motif. Leucine zipper motif. Next time they may ask, although not asked previously, helix turn helix motif. Lac pressure. Yes. Mick genes have leucine zipper motif. Yes. Now, thank you, friends. It's your hard work, and definitely you will clear this exam. And biochemistry was really, really simple paper. I feel like this. Okay. Night blindness, retinitis pigmentosa. If you remember, I told you R for Refsum disease, R for retinitis pigmentosa. Yes. And other than that, phytanic acid is given. So simple question, simple answer. Yes. Yes. Two options. Yes, in this other options, even if given, no need to think, you will find the answer very easily. Okay. In this helix turn helix motif, leucine zipper motif, examples I have given. Yes, this table from Harper. This page, this question. Yes. Yes. This question. Yes, I want your support. If image is this crumpled tissue paper appearance, this hepatosplenomegaly may be present in Gaucher disease, Niemann-Pick disease. If this is crumpled tissue paper appearance, then answer is Gaucher disease. But few students told, sir, it was foamy appearance. Yes, bubbly appearance. Mnemonic was neem soap. If you take bath with neem soap, your bubbles would not be so clear as Nirma girl because you take bath after so long time. So that's why your bubbles are not so clear. Huh? So Niemann Pick's disease, bubbly appearance. Yes, gouge, ouch, ouch, bone pain. Yes, few students told that some detailed history was also given. Yes, bone pain was there, hepatosplenomegaly was there, crumpled tissue paper. Yes. Okay, what was the round bubble, bubbly? एक सोप बबल थी. ओके, तो इमेज एक बार सर्च करते हैं. इफ यू हैव एनी आइडिया अबाउट द इमेज, कुछ मिले तो बताना दोस्त. यस, ए नियोनेट प्रेजेंट विद लो सिट्रुलिन लेवल लो है. यस, अगेन इसमें तुम्हारा सपोर्ट चाहिएगा. Normal orotic acid level, high glutamine. What is the diagnosis? Hyperammonemia. Yes, in hyperammonemia, wherever ammonia is increased, it bind with alpha ketoglutarate to form glutamate. Again, bind with ammonia to form glutamine. In urea cycle defect, glutamine is increased. So, this is not a problem for us. Yes. Yes. Okay. Glutamine. Okay. Orotic acid urea. Okay. I put. Yes, not orotic aciduria, organic. Even then, this is typical picture. Yes, type 1 hyperammonemia, you can solve all the description by this type 1 hyperammonemia. Let me tell you the answer first. Yes, if type 1 hyperammonemia, CPS1 is deficient, then ammonia will be increased, hyperammonemia. This carbamoyl phosphate will not be produced, citrulline will not be produced, orotic acid will not be produced. That's a hyperammonemia. Yes, low citrulline level, hyperammonemia, normal orotic acid level. Yes, maybe due to this pyrimidine synthesis. Now I will rule out other option, type 2 hyperammonemia. In type 2 hyperammonemia, there is orotic acid urea. Orotic acid urea. Okay. If hepatic encephalopathy is there, definitely these are symptoms, but even then, you will prefer to mark type 1 hyperammonemia. Okay? Because this is typical picture. Now, which of the following is defective in patient presenting with eruptive xanthoma with increased chylomicron? Yes, if chylomicrons are increased, eruptive xanthomas are there. Chylomicron increased eruptive xanthomas. Yes, eruptive xanthoma. Yes, this is eruptive xanthoma. Chylomicron increased. Then there is maybe defect in lipoprotein lipase or ApoC2. Lipoprotein lipase and ApoC2 or ApoC2 defect. Yes, ApoB100 defect, ApoB100 defect will lead to, even if ApoB100, there would be increased LDL, increased cholesterol, tendon xanthoma would be there. Yes. ApoE defect, type 3 hyperlipoproteinemia. This question is type 1 hyperlipoproteinemia. Type 1 hyperlipoproteinemia. Yes. So answer is lipoprotein lipase. One more question. Defect in conversion of uroporphyrinogen third to uroporphyrinogen, coproporphyrinogen third. Which enzyme is defective? Decarboxylase. Yes, if you remember, we discussed that Porphyria cutánea tarda, काटा तोड़ा, क्या तोड़ा, carbon dioxide काटा, carbon dioxide तोड़ा, it convert uroporphyrin third to uroporphyrin, coproporphyrin third, uro to copro. Okay, yes, clear. So if you have any other question left, please do comment. I will include in the main recall. These few options are missing. We will complete in the main video. Thank you, best wishes, and definitely you will clear this exam.